Hi guys, this is me Kong again from Posh Coaching Classes. Today's video is of utmost importance for all of us because in today's video I'm going to take you through few steps, to be precise 9 steps or instructions for the patients who are actually suffering from COVID-19 and they are in home isolation. So if we have a patient who is suffering from COVID-19 and he is in home isolation, what are the 9 things or the 9 steps we should make sure that he is following? Even the family members are following those steps. And afterwards I will let you know if there is a patient that is COVID-19 positive, and if he's at home, then when is the requirement for the doctor's assistance. So that's also in the video. So let's start. So the first point or the first instruction for all the family members is that the patient must isolate himself or herself from other household members. What does that mean? That it means that the patient should be kept in a room which is not used by the other members of the family. So he should be in such a room which has got an attached bathroom so that he can use the bathroom as well, and nobody else is using that room or that bathroom for the amount of time he is in. All right. The second one is patient should be kept in a well ventilated room with cross ventilation because he needs to breathe well, and in case if the room is not ventilated, he may have oxygen issues, he may have breathing issues, so he should be kept in a well ventilated room. The third one is the patient should all the time use triple layer mask because this is very important. He might sneeze, he might cough, and at that time the virus may come out. So if he is using a triple layer mask, it will be good for the family members as well as for himself. And on top of that, one more thing, there will be a person in the family who will be taking care of the COVID-19 patient. Even he has to wear a triple layer mask whenever he enters the room where the COVID-19 patient is kept. Afterwards, we use mask. Even the COVID patients use masks. They should not be thrown just like that. The COVID-19 person, if he is using a mask, it has to be discarded. It has to be thrown. But we cannot throw the mask just like that. It has to be disinfected. Then only we can throw the mask. It should not be thrown in the streets without disinfecting. After that, we have the patient must take rest and drink a lot of fluid because his body should not be dehydrated. His body should have hydration. So for that, he should take rest, and at the same time, he should have a lot of water, a lot of fluid. Then the patient should definitely cover his nose, mouth at the time of sneezing and coughing. As I said earlier as well, he has to cover the mouth. He has to cover his mouth using a mask. He can use a mask, triple layer mask, just like I said it earlier as well. A triple layer mask is a must for the patient. Then the patient must use the water bottle, the soap, the towel, the comb, even the mobile phone. It should not be used by anyone else. The patient's things, the belongings of the patient till the time he is suffering from COVID-19, he should be the only person who is using these things. These are the personal things I'm talking about. And once he is well, once he is out of this disease, these things should be disinfected again. You can use a bleach. You can use a lot of disinfectants are there in the market. You can use those disinfectants and make sure that the things used by the person are disinfected properly, and then only the other person or the people in the family or the friends or the family members can use those things. Then the next one is frequent hand washing. It is important for the person who is suffering from COVID-19 as well as it is important for all of us. We should be frequently washing our hands with the soap. In case we don't have water nearby, then obviously we have disinfectants, we have sprays, we have a lot of things wherein we can use those things, and we can disinfect our hands, because hands move quite a lot. We should not use hands to cover our nose or mouth for that matter. Next one, the door knobs, the window knobs, the window handles, floor, it should be disinfected and cleaned on a regular basis. So these things can have virus, because these things are used by the person. So the person is infected, he may leave some strands of the virus on these things. So we should clean these things up. This is of utmost importance, and regularly every day this should be done. So these were the 9 points I was talking about. These 9 points are of utmost importance, and on top of that we can definitely self-monitor ourselves. You might have seen these things. This is the oximeter, then we have the digital thermometer. These two things are very important at this point of time, because these two things, this thing will obviously give us the oxygen level, and this thing will give us the temperature of the body. So we should understand that these two things are very important. We should regularly check ourselves. We should check the temperature, we should check the oxygen level, and the oxygen level should not dip, right? So these were a few things that I wanted to tell you. Afterwards, I said that when the patient needs medication from the doctors, when the patient should seek medical attention, there are 4 points which we need to understand, and there are 4 things which we need to keep in mind. The first thing is, if the person is having difficulty in breathing, he should definitely consult a doctor. The second one is, if he's having continuous pain or pressure on the chest, he has to consult a doctor. Then, using oximeter, the COVID-19 patient has to check his oxygen level regularly. If the oxygen level dips to 90%, the room air temperature in the room, so he has to definitely consult the doctor. And the last thing, if the person is not able to get up, if he's having some mental confusions, he should definitely consult a doctor. So these were the 4 points. I hope you understand these points. I hope you just adhere to these points. So just make sure these points are important for all of us, just not for the COVID-19 patients. We should be ready for anything. So we should know what are the do's and don'ts when there is a COVID-19 patient in the house. So that's about it. This is me signing off for today. Please do subscribe to Posh Coaching Classes on YouTube, and please do share this video to all your near and dear ones, because this video will give them a bit of information. There will be something which is good for them as well. So knowledge is always good. So thank you so much for watching this video, and please do subscribe to Posh Coaching Classes. Thank you so much. You take care and have good health. Thank you.